On behalf of our team, congratulations on your liposuction or fat transfer procedure. This video will guide you through what to expect in the months to come after your procedure to ensure a smooth and seamless recovery. My name is Kelly, and I'm going to be talking with you about your first week of recovery. There is a lot of information to cover in the first week, so let's go over everything by categories. And the first topic I would like to cover is how you will feel the day of your surgery. Afterwards, you're going to be feeling very sleepy. You'll need somebody you know and trust to take you home from your procedure. They will need to stay with you for 24 hours. You will see that you have a drain or two in place unless you only had your arms or legs done. The nurses at discharge will show you how to care for your drains, but if you want to get a heads up on that, YouTube has really great videos on Jackson Pratt drains and how to care for them. But we'll show you again in person as well. You will be placed in a compression garment after your surgery with the help of the nursing staff. You do want to leave this on until you're seen in office for your first post-op, and then we'll show you how it works, how to take it off, how to put it back on. After your procedure, you will want to be cozy, so make sure to bring a loose fitted pant, zip-up jacket, flip-flops, slippers, something easy to get on and off, but you will want to head home and go straight to bed after surgery. We don't want you to wear anything tight over your surgical area, so plan ahead for that as well. That means no yoga pants, no jeans, anything with a tight waistband, because this can also cause indentations, and those indentations can be permanent, so think loose. Your caregiver is going to be given a list of medications to give you, as well as when to give them to you. These typically include a pain medication, nausea medications, and a medication to help with inflammation or swelling. For your car ride home, do put down a couple of chucks or puppy pads to catch any fluid that may drain from the incision. Do not be alarmed if it is a significant amount. It's going to be red, it's going to be watery. We do want a phone call if you see more of a thick red chunky consistency. Give us a call if you see that. It's not very common to see a lot of drainage because we do use the drains, and your incisions are sewn up and covered with bandages, which also means you do not have to do any sort of wound care after surgery. But keep an eye on your incisions just in case you see any new redness, any weird discharge. Give us a call on that end. If you had a fat transfer to your buttocks, make sure to bring a soft pillow to sit on, and avoid sitting for longer than 20 minutes at a time for the first 6 weeks or so after your BBL. They make special pillows for this, and you can buy those off Amazon. They're pretty decently priced, around $30–40 bucks. When you get home, go to your preset cozy zone. So lots of blankets, lots of pillows, magazines, Netflix, your phone charger, water bottles, snacks, anything that you can think of to keep you cozy and occupied. And then every couple of hours, do get up from your cozy spot, walk around for about 10 minutes, and this will help with circulation and lower your risk of blood clots. We don't want you walking too much, so just around the house. And then make sure your caregiver is close by, just in case you get lightheaded, which is not uncommon after surgery. We don't want you to pass out, so keep them close. As far as discomfort goes, anticipate a little bit of discomfort for the first day or so, but as the lidocaine wears off, you will feel more and more uncomfortable. That's where you're going to be taking your pain medication, and make sure to stay on schedule with that. We'll direct you as to when to take those after your surgery. When you're taking them, eat a little snack, and that's gonna also help prevent nausea. For that first night, make sure to get a good night's sleep. With lipo, it depends on how you can sleep, and we'll advise you on how to do so at your post-op. The following days after your surgery, hopefully the pain starts to improve. The first 3 to 4 days are the most difficult for most patients. Just remember to take your pain meds. If you need to, add a stool softener to your routine, as the painkillers can cause constipation. We want to ensure you're getting plenty of protein, plenty of fluids, and this is going to help you feel better faster. As far as showering goes, you can shower 1 to 3 days after surgery, just depending on your surgeon's specific instructions. Your drains will start to slow down a few days after your surgery, so make sure you're keeping track of the output on the sheet that was given to you at pre-op. For your energy levels, you're gonna be feeling a little bit weak, a little bit slow on your first week of recovery, so listen to your body. You need to rest. You will be going through quite a few emotions, ranging from happy to sad to excited, and this is all normal and part of the healing process. Many patients want to know when they can exercise as well after their surgery, and typically it's going to be about 3 to 4 weeks. We'll go over that with you as you're recovering and give you your own personalized schedule. If you've had a fat transfer, you do need to wait 6 weeks for exercise. You do want to only walk for about 10 minutes at a time for this first few weeks, and that's just going to be, again, around the house. After surgery, you will be able to drive yourself to your post-ops, But you do need to be off of your narcotics for 24 hours, so I would plan on having somebody to take you for the first couple of days, maybe even the first week, just depending on how you're feeling. And then a reminder on clothing, nothing tight around your lipoed areas. And again, that is because we don't want to cause indentations. So dresses, sweaters, loose bras, things like that for the next 6 weeks. And that pretty much covers it for your first week. It's going to be a lot of resting, relaxing, and you just need to focus on your recovery. And your results, they are so far in the future, about 16 weeks, so please do not get discouraged as your body's going through changes. And as always, please call our office if you have any questions or concerns, and please stop by anytime you feel like you need some reassurance. We are all here for you.
Hello, my name is Azucena and I am one of the nurses here. I'm so excited for you. How are you feeling? 1 week to 4 weeks can bring its challenges as your body is adjusting to your procedure, but please know it gets better and we are with you every step of the way. You are going to look awesome. After the first week, you will still feel very tired. Make sure you rest and be gentle with yourself. Drink a lot of water and eat low salt, high protein meals. You might not have a bit of an appetite, but you do need to feed yourself. Your body is burning more calories right now in order to heal the areas that we treated. It is imperative that you replenish with nutrients throughout your recovery. The first few days and week after your liposuction procedure can be pretty emotional. This is very common and normal. You're starting your healing and recovery and will start to feel pain and also some mood swings. In some patients, you might even feel depression. We're here to help you and to remind you that this is temporary. Make sure that you have a great support system at home and online, and also remember we are your biggest cheerleaders and are always here to listen. Trust the process. You're never alone, and our favorite part is seeing you happy at the end. Let's talk about your drains, your best friend and worst enemy. Depending how you feel about them, they are still there to help you with your recovery. You will most likely have your drain in for about 1 to 2 weeks. You will need to keep milking your drain daily, at least twice a day to get the drain flowing. You will notice the drain go from a red color to a light orange, yellow, and sometimes even a green color. This is normal. We cannot say an exact day on when your drains will be removed, which is why we have you keep track of the amount of the output. Once the drain has not had an output of 20 cc's in a course of 24 hours, that tells us it's ready to be removed. However, once the drain is removed, you are not in the clear. It is important you keep your activity light for another week after we remove your drain in order to prevent fluid accumulation under your skin, which is known as a seroma. If this does happen to you, don't panic. It happens and we will help drain it for you until the seroma subsides. You can't go for walks yet. Do not try to do stuff around your house, such as cleaning, laundry, gardening. Keep your activities very light and low and allow your body to heal. This is what your drain looks like. It has numbers, that way you could log it. How does this work? It works by creating negative pressure. So you're going to empty out the fluid as well as the air, put your cap back on, and it looks like this. You want it to look like a deflated balloon. That way it pulls the fluid inside of here. You also need to milk your drain. What I mean is you're going to hold and push through the tube of the drain, and this helps get your drain flowing. If you have dissolvable sutures, they tend to feel like a knot under your skin. You can massage the area at week 4 to start breaking it up. Ideally, if you do leave it alone, it will be dissolved as well. If your sutures do need to be removed, they typically come out somewhere between 7 to 10 days, and that's something that we take care of. Remember, everybody's recovery is different. Approaching several weeks after your surgery, your bruising will start to subside for the most part. You will also look at yourself in the mirror and see a lot of swelling. Continue to wear your garment 24 hours for the first 4 weeks. This is going to help you a lot. The peak of swelling is actually at week 3 to week 4. Don't try to weigh yourself or judge your results yet. Your water weight and retention from the surgery is still there 3 to 4 weeks post-operatively. Your treated areas will feel very hard. This is known as the induration period, and you might also see a few bumps and lumps under your skin, which is very normal. This is the collagen forming under your skin. We encourage that you massage the area either with a handheld device, a lipo ab roller, or even your hand. The lumpy, bumpy phase isn't the prettiest, but it is very normal. Remind yourself to trust the process. Your treated areas may feel very numb as well. This is normal. The nerves will start to wake up on their own. Some people describe it as a quick burning pain that comes and goes. We call it kind of a zinger feeling. You might feel very itchy, and though this is an indication of healing, try to avoid scratching your skin because it can result in hyperpigmentation of your skin. We talked about your activity remaining low after your procedure. You are not cleared yet during this time. Our nurses and your doctor will clear you when you're able to go back to full activity and to the gym. We will release you progressively based on the activity, but always ask before assuming. No bubble baths, hot tubs, or anything like that while your incisions are still healing. Just regular showers for about the first 4 weeks. During 1 to 4 weeks, you are still in your compression garment, and that's there to help you with the swelling. You also do not want to wear any tight clothing or anything with an elastic band. This is to help prevent any type of deformities on your skin. Ladies, if you're scheduled to get your period during this time, it might be delayed or irregular. This is normal, and you should return your normal cycle and flow as you continue your healing. Your body is stressed from your procedure, which in return can affect your period. Right after surgery, you might experience some swelling in the private area, such as your scrotum or your mons pubic area. This is normal. It typically goes away after a week, and to help alleviate those symptoms, we would recommend you to sit on a pillow to give some compression of the private area. After a fat transfer, we recommend that you try to avoid sitting on your buttock. We recommend that you either sit on soft surfaces, a soft pillow, and avoid sitting on hard surfaces. You can purchase a BBL pillow such as this one. You could buy it on Amazon. It doesn't have to be anything fancy, and I will demonstrate how we use it. Okay. So the goal is to put this here, and you're sitting on your thighs, releasing all of the pressure off of the buttock area. While your recovery may seem hard or unexpected, try not to let it take over your excitement of your end results. We are here with you and tracking your recovery and helping to ensure wonderful outcomes. It will all be worth it.
My name is Emily, and I'm so excited for you and your journey. I will be going over a couple key points for your procedure at months 1 through 3. Your results are starting to show as your bruising and swelling have started to die down. Mobility is getting to be a little bit easier for you. You may be feeling a lot more like yourself as your energy levels will continually improve. You're at the point where most of the significant swelling has gone down. You will still notice if you eat a lot of sodium and are on your feet for an extended period of time, some possible swelling. Continue to try to eat a healthy, high-protein diet and drink lots of fluids. Your body is still healing. Numbness in the surgical areas may be present as your nerves are continually regenerating and healing. You're able to bathe at this point if your incisions have scabbed and come off. If you have had the fat transfer to the buttock, please try to limit sitting for 6 weeks at 20 minutes at a time. If you had the BBL procedure, you're able to work out at 6 weeks. For tummy tuck, the time frame is 6 weeks as well. For Vaser liposuction, you are able to start working out at 4 weeks. Remember to take it slow and ease yourself into normal exercise routine. If you notice a significant increase in swelling or pain, please slow down and listen to your body. Lots of patients ask when they can go back to wearing normal clothing. With the tummy tuck, lipo, and BBL, pants can be worn at 3 weeks with a loose waistband. At 6 weeks, you may go back to your normal clothing. For optimal healing and circulation, we recommend no smoking of any kind, including vaping, for a month after your procedure. You are able to take off the garment at 3 to 6 weeks, depending on your swelling and healing process. After that time frame, you are able to wear it for comfort. Scar cream can be used after 6 weeks. Your nurse or doctor will advise a proper cream for you depending on what procedure you had. Please be patient with the process. Months 1 and 3 are exciting as your results are starting to shine and your body is still healing.
Hi, my name is Kara and I'm one of your nurses, and I'm here to walk you through what to expect for your liposuction fat transfer procedures post-operatively. Around 3 months after your procedure, you're starting to feel like you again. You will still have some reminders or physical sensations that you've had surgery, but for the most part, you may return to life before your surgery. What does that mean? Well, after 3 to 4 months, you are typically cleared for full exercise by your surgeon. You are free of any accessories like those drains or garments, and you don't have any restrictions at work or home. We will schedule your 3-month post-op appointment with your doctor, and this is where we can start to look at your final healing and how your results are starting to conclude. By 6 months, most of your recovery has occurred, and your 6-month post-op visit is generally quick and easy, where we will get photos and discuss more of these points. When you're 6 months post-op from your procedure, there are still no further restrictions, and you may resume all normal activity and exercise. You may still have some residual nerve pain, and those nerves do take time to heal, and there even may be times after activity that you still have some swelling. So don't worry, this is normal, but as always, please reach out to us if you have any questions or concerns. The lumps, bumps, and tightness generally have resolved. However, sometimes it takes longer too for the area to heal and to look normal, natural, so you can continue with a massage if needed at home or a normal massage elsewhere. Your results will start to feel more natural and truly the new you. During this time period, we can also start talking about doing another liposuction or fat transfer procedure as you are healed and cleared. Recovery for the most part will look the same. It's important to remember that liposuction is a body contouring procedure more than a weight loss solution. This is why we highly recommend maintaining your results through diet and exercise. Our main goal for our patients are for them to feel heard, safe, and supported, but ultimately, we want you to be happy. At your 1-year post-op appointment, we will discuss your final results and how you feel physically and emotionally. Waiting for the full 12 months to discuss your full and final results is also important, as everyone heals differently. We're so excited for you. Thank you for choosing our team for your liposuction and fat transfer procedures. And please reach out with any questions, and we wish you a smooth recovery.